I remember when I qualified, I went to so many postgraduate courses afterwards and I learned a lot of information. I was a bit like Leah, I was a bit of a perfectionist. I want to learn from the best of the best on the planet. So I took a lot of information from a lot of practitioners, a lot of courses. But I found there's a disconnect between what I knew and what I learned in my mind and what I was actually practicing. There was a bit of a divide between the two because you don't always get to practice everything you learn. And I see some of you smiling, I think you're probably doing it already. But there's going to be a disconnect, so it's a wise idea to learn as much as you can because you're never going to always practice it. But that annoyed me so much that I decided to do something about it. For me, that wasn't excellence. And here's what I did. You may find this tip useful. I decided on a daily basis to audit my work. Initially, in my first practice, we weren't so busy, so I could do that. I had the luxury of time on my hand. So I started auditing myself on a patient-by-patient, day-by-day, week-by-week, month-by-month basis, such that I had two lists. I had a Sony Vaio laptop open, had two lists on that Vaio laptop. One of the things was what didn't work for me in practice, and the other list was what did work for me in practice. And I did this for 2 years, such that by the end of the 2 years, when I crossed off the synonyms and the things which are similar, I had hundreds and hundreds of things which didn't work for me in practice, and I had a list of hundreds and hundreds of things which worked for me in practice. So what I did was I stopped doing the things which didn't work for me, and I started doing more of the things that worked for me. You may have heard about the Pareto principle, 80-20 rule. So I started doing 20% of the things in practice, which gave me 80% of the results. So I went and actually, in essence, I went from unconsciously incompetent in my practice to unconsciously competent. And when you start repeating things like this, you neuroplasticize your brain, you ligate your brain by Swan and by myelin cells, and you start to religate these things. So the lower things in your practice, they become automatic, and you go on to higher things. That's the only way you can have clinical excellence in your practice. You actually owe that to yourself to grow in your practice, because if you grow in your practice, you grow in your business. But you also owe it to your patients. Your clinical excellence has to grow at least on a yearly basis just to match the rate of inflation, if anything else. But you also owe it to the profession, because it's only when the individual practitioner grows that the consciousness of the profession, the dental profession, or whatever profession you're in, only then will that profession grow. So you also owe it to the profession. And by auditing your work, researching your work, you're then researching your business. Your business will grow by like a side effect of that, because you are growing. Which brings me on to the second component. Are you with me so far? Is anybody not getting anything I'm saying? Okay, you're with me.